Hi everybody, this is Dr. Robert Caridi from Westlake Plastic Surgery, and my video today is going to be about the incisions for a breast augmentation. This is my model here, so we're going to zoom in on my model and we're just going to kind of go through these various alternatives. The first alternative and the gold standard for incisions is the one underneath the breast. Now this patient already had a breast augmentation, but the inframammary ones or in the breast fold is down here. That's about how long it is. This is the gold standard incision from which all other incisions have to be compared, which basically means it's the most consistent, it's the most reliable, and it's the most commonly performed by all plastic surgeons. Second incision alternative is at the areola border, and this patient actually had an incision at the areola border, and it's probably pretty hard to see, but typically it would go right through here. Now the ideal patient for the areola border incision is someone who has a nice sharp demarcation between the areola and the skin. In her case, she actually has some wispiness here and it's not real sharp, but if someone has a real sharp demarcation, those are good candidates. A lot of patients don't like this incision because it's so close to the nipple areola complex that I think it's just too personal, too close, and too much stuff can happen from this incision. But it actually is a good incision. If it heals well, it's amazing because you can't see a darn thing. But if the incision heals a little wider, a little darker, it is visible, and so you got to be careful about that incision. It can also be associated with more problems than this incision because it's close to the ducts in here, which actually have bacteria in them. And sometimes you can have some healing irregularities. So it's a good incision, but it's just not preferred by most patients. The next incision that's possible is the one under the arm. If you can get over here, zoom in here. At the axillary apex, this would be right in here. That would be the incision here. It's called a transaxillary incision, and basically through this incision, this implant is inserted into this area here. It's not the most popular incision because it's fraught with some potential downsides. Anyone can tell you it's a wonderful one. It's okay when it works, when it's not great if it doesn't work. You really would have a hard time putting in a good sized silicone implant through here. So the saline are a better variety than the silicone for sure. And it's more prone for some positional errors of getting the implant just where you want to get it, and sometimes you have to use special instrumentation and it may take a little longer. There's some concern that's not completely thought out yet in terms of science of whether or not this would interfere with lymph node examination. You got to remember that breast cancer is a common cancer in women, and so doing something in this area may interfere with the analysis of the lymph nodes. Okay, put your hand down. Probably the last incision is what we call a tuber incision, which is a transumbilical incision. That's an incision down here in the belly button area here. This is not a good incision. It's not a great idea. It's just too far from where you need to be, and quite frankly, it's fraught with potential downsides. And people who offer this incision are probably doing it for reasons of people may think they want it there and no one else really wants to do it there. Therefore, they become popular by doing it through that incisions. I don't recommend it. It's also limited to saline implants as well. These saline implants are really not popular implants in general. So the fact of the matter is that the incision for a saline implant is best to go right in here, and it's such a tiny incision. Why not just go underneath the bottom of the breast? The bottom line is any incision is actually pretty good in the ideal patient, but it's important to know that by far the number one incision is this one underneath the breast here. You have the most control of the breast pocket. You can use the silicone or the saline variety. People who have small areolas may not be able to get in an implant because it's just so small. So like I said, this incision here is the best of the best. So anyway, that's just my purview of incisions for breast augmentations. I hope that you found it helpful. And if you have any questions, just reach out to me at westlakeplasticsurgery.com. Thank you.